We opened our doors August 30th of 2010, and staff came from all over the health department to have a joint venture to open this clinic in an area that was really underserved and desperately needed more access to health care. This is the poorest zip code in Multnomah County and has the fastest growing homeless population also in the county. Poverty is just moving east all the time, and there might not be quite so many people living on the streets, but there's a lot of couch surfing going on.
I've been struck by poverty and where this economic downturn has placed people who are already vulnerable. I mean, so many people are at wit's end. They are at they don't know where they're going to get the money to get through this month. They don't know where to put their dollar to housing, food, or medicine. I mean, actually, this place is full of stories of survival against tough odds, really tough odds. So I think I didn't quite anticipate the seriousness of the social challenges our patients deal with here.
I have a lot of medical conditions that require monthly medications, and they're very expensive. And I thought, or I had hoped, that I would be eligible for a medical for retirees through the state of Oregon, which I was not. I was 28 days short of getting my medical. So, to coin an old cliche, they basically saved my life, because they did. Without the medication, I wouldn't be here.
It's amazing that we've seen more patients every day, every week, every month. Like in the dental areas, between like 1,500 and 1,600 patients that we have now, and we provide close to 4,000 visits since we opened. And the medical, we have about close to 3,000 patients, and we've provided close to 11,000 visits.
I love everything about my job. I have a really great team, wonderful management, and very diverse patients and great doctors. I've never worked with Korean patients or Burmese patients, so that was really wonderful to learn some of the language, and communicating with them was really great.
We from Burma. We went to Thailand and here to America. We're from refugee. When we come to Oregon, he was pretty sick about it. He was in bed all the time, no eating anything. When he started getting the medicine, he felt so good. He get to #1. It helps a lot.
Whenever we have a patient who does not speak English come to the pharmacy, we obtain interpretive services either from a staff member who speaks their language or from our OPI telephone interpretive services. In that case, I'm on the telephone, the patient is on the telephone, and there's an interpreter on the line between us, translating between the two of us.
What makes a difference here from other places is it is the family thing, and they listen to you here. It doesn't matter if it's the front desk or if it's the nurses or the doctors, they all treat you with respect.
The group that they have here, they did such a fine job in selecting them, and even they're helping people, their nurses and assistants and stuff. They're all just a wonderful group of people. So I think they would be a nice model for other clinics or even private sectors.
We're all about helping patients and giving them good care, so it feels really wonderful when somebody appreciates you.
Rockwood is here to stay. We're here to help the community. We're trying to reach out and be involved in the community, and we're going to take really good care of the people who come here.